We're at day 2 here, going for a walk. It's not been too bad. I managed to do it without any of the pain meds. Sleep is kind of sporadic. It'll be 2-3 hours a day, napping a lot. But there's some positions now it doesn't feel painful. So like right now, if I have my neck in a perfect spot, it don't hurt. Did some basic neck stretching and movements we'll go over later. I'm gonna try something with a band as well. Appetite is back. It's still really hard to swallow. It feels like this right here. I don't know if it's the incision, the swelling around the incision, how they had the tube down my throat, but that's gonna take some time. It feels like I have to force myself to swallow. Got a 6-week flash forward to day 2 now, so looking at where I was, the pain swallowing, that took a long time to get rid of. It was probably about 5 days to when I stopped being annoyed by it. So if you had that, just kind of try to be patient, set up what you can for that, warm fluid, soup, easy to swallow things, yogurt, bananas, things that get chewed and they're not sharp or jagged, anything like that. So look through eggs. Eggs, fantastic. Oh, bread, soft, warm bread, things like that. Just make it as easy as possible. I still notice it when I swallow, unfortunately. I mean, it's been 44 whatever days, and it's probably going to be months before I stop noticing it. But I'm using this to my advantage because my main symptom I'm concerned about was the pinched nerve here, how it affected my left arm, my grip, pressing, and especially pull work. For some reason, it really affected anything related to my lat and overhead. It just being overhead at all, my arm would go numb eventually. It was probably 2/3 the strength to prior to being injured. So a lot of progress made there. Back with that, the point I was making, if my nerves here are recovering at a certain rate, I'm going to assume the nerve that was pinched is doing something along the same lines. It's not very easy for me to tell if something has made progress in my arm. Sometimes it just feels like I've adapted to it better. I got better at a move I'm using. I am going to get stronger slightly, things like that. This is going to be my big indicator of like, okay, I noticed 6 weeks ago how this felt. There's probably something similar here, even if I don't notice it as drastically as this. So it's tricky. You just have to be patient, and that's been one of the hardest things. I'll come in and I'll be like, man, I feel great. I should just jump back to where I was way before, and I have to keep making these incremental jumps. Whatever it is you're doing, get a system going for yourself. What I like to do with upper body dumbbell moves, it'll be either 2 reps or 5 pounds for the increase each workout. For lower body, every dumbbell move, it's 5 pounds every time. So I've got a split squat, I've got lateral lunge, that's going up right now, 5 pounds every time. The barbell moves, things like that for upper body, it's 10 pounds every time. So my bench is going up 10 pounds every time. That's appropriate for me. Again, at my best, I did 415 for 6 on bench. Even prior to surgery, I was able to do 300 for like 7 or 8. So with the injury, I was able to do that. That's what I'm going to build back up to. I'll be at a point where I'm doing 315 for 8 when I say I feel normal again. So it's more weight equals bigger jumps, less weight equals smaller jumps. You might look at what I'm doing and say, I'll probably do a jump like that every 2 weeks. I'll go up 1 rep, and then another rep, and then 5 pounds. A rep, 5 pounds. That's fine. That's awesome. That's progress. You can see it. This plays into what we said with breaking down goals from previously. Be patient. Do not injure yourself again. If you are new to fitness, if you are coming off a surgery, coming off an injury, be patient. Do not hurt yourself again. I did the mental work reviewing how I think I got this. I had injured my right arm deadlifting in an event. Something failed with my strap. It pulled a pronator in my right arm. So when I was doing press work, it would overload my left side, and that imbalance probably started straining my neck, especially in overhead press. So I think one of my lifts prior to the contest, I remember tweaking something, and it just felt like, okay, well, I strained my neck. I've done this before. It healed. I went to the contest. I've got 290 overhead in a log, which is really awkward. I'm hitting my third rep. I'm trying to lock out. I'm all over the place. I go to deadlift the frame that's 700 pounds. It's bouncing around a little bit. I'm pushing through reps, and that was where it was at. I got sick after the contest. I had this real bad coughing attack. It felt like someone jammed a metal rod through my trap and into my rib. The whole left side of my body wasn't working right. It felt like this massive cramp on my left lat and rhomboid. I rolled it out for days. I was having spasms on the left side. Days of seeing different physicians and primary care and was it urgent care? They're horse shit. Every time I've gone there, I went there once when I had pneumonia, and like, oh, you're fine. Here's a Z-Pack and a cough suppressant. And your breathing sounds perfectly clear. And then I see my primary 3 days later when they're in, because it was a Friday night or whatever, and they're like, no, you got pneumonia. We're doing x-rays. We're checking everything. This is horrible. Here's a month of prednisone. Here's all this other shit you need to take. Like, don't be afraid to get second opinions on anything. And if something doesn't make sense, there's probably a reason why. Ask the questions. I was fortunate to where I got to a really, really good surgeon. Didn't like the people doing my physical therapy, but surgeon, top notch. He cares, he listens, he explains what's going on, he explains options, he explains why you would use those options. If you're going through anything, I don't have a surgeon, I don't have neck surgery, blah, blah, blah. Do you have a personal trainer? Do you have a dietitian? Do you have any number of things? Do you have a psychiatrist? Do you have a therapist? Do you have somebody in your life whose job is to take your money and help you with a problem that they specialize in? Okay, this is a good process for you, and you should be thinking through things like this. Hopefully this helps. That's the whole point of all this. Comment, like, subscribe. If you have questions, by all means, put it in there. Hopefully I can start adding things into the next videos as we go along, and just hang in there. Stay positive. Surround yourself with positive people who support you and your goals. Good luck.